Good morning, good afternoon, and good evening to all the doctors. I welcome you all to the English session. And let's start the session with the small prayer. Thank you all. I welcome you all to the 1755 day of uninterrupted session. We all know that IFPH is conducting every day 3 sessions, and now we are gathered here for the second session. I welcome you all doctors for the English session. And now I like to welcome our today's guest, Dr. PANKAJ and LATHIA, Professor in Community Medicine, Chief Consultant in Homeopathy Clinic, having more than 15 years of clinical experience and 10 years of teaching experience, written various articles in different magazines, and he is a winner of many awards, Dhanvantri Award winner 3 times, a judge for some of the leading schools, as an expert for various schools. Now, he is here to present on the topic of a series of evidence-based case studies on the evaluation and individualized homeopathic treatment of Verruca vulgaris. I welcome you, sir, Dr. PANKAJ and LATHIA, and the mic is yours. You can start the session. You can take for 45 minutes, sir, and you can please allot the last 10 minutes for discussion.
Okay, sir. Good evening, everyone. So let's start today's topic. This is a very interesting topic. Today, I'm going to present. My topic name is a series of evidence-based case studies on the evaluation and individualized homeopathic treatment of Verruca vulgaris. As you all know that Dr. Verruca vulgaris is a very common clinical condition nowadays. So we must know about each and every parameters of the treatment, homeopathic treatment, which will be useful in cases of Verruca vulgaris. So let's start. What is Verruca vulgaris? Verruca vulgaris common viral warts, benign skin lesion which are caused by human papilloma virus. There are 5 types of warts with different clinical features, but I have seen in my clinical practice that common warts is a very commonly seen in our clinic. So as you all know that allopathic approach for the warts main treatment are the tropical medicine, that is the external application, and allopathic doctors mainly treated warts with the cauterization. So choice of treatment is the cauterization. Research problem. What is the efficacy of homeopathic remedies in a mild and non-invasive treatment of Verruca vulgaris? These are my research problem. So what is the homeopathic approach? According to homeopathic principle, we treat patient as a whole. Mental as well as physical general are taken and symptoms are evaluated according to the severity. The evaluated symptoms are conjoined together in one as a totality of symptoms. After the totality, homeopathic medicine is selected on the basis of characteristic symptoms. In this way, homeopathic prescription based on individualization of the patient as well as medicine. Warts are classified under one-sided disease which have very few symptoms. They are further categorized as external local maladies, changes and ailments that appear on the external parts of the body. So, homeopathic science believe that there is an internal propensity to disease along with external virulence. Any disturbance in nature of a dynamic change is never confined to a specific part of the organism. So body doesn't participate in the dynamic change produced by any means. These are the homeopathic approach. I think you all know very well. This explains why only some people are affected by the virus, whereas others don't. This is further related by immunological basis in cases of warts. We commonly witness families having propensity for growth and warts. These tendencies are termed miasm. In this case, psychotic. Commonly, warts are included under miasm psychosis. So, although warts are a local disease, they are treated with internal remedy, which is based on comprehensive understanding of the patient. This includes local symptoms, means morphology and location of the lesion, mental makeup of the person, and physical characteristic symptom. In this way, a constitutional remedy which was selected on the basis of totality, it eradicates the complaints locally as well as internally. So let's see one by one cases and my research work. First of all, I want to tell you what is intercurrent remedy, because intercurrent remedy are very useful in cases of warts. So intercurrent remedy are those remedy which is given in the course of treatment of the patient for chronic disease. It will be helpful in removing any acute diseases or accelerating the mode of cure or removing any hindrances called miasmatic blocks. During treatment, in some chronic cases, despite of well-selected remedy, improvement ceases after a time because of deficient reaction or diminished susceptibility. In such type of cases, intercurrent remedy will be very useful. Sometimes well-selected medicine doesn't act, indicates intercurrent remedy. It should be used in higher potency like 200, 1M and 10M. We can use nosodes, sarcodes and anti-miasmatic remedy as an intercurrent remedy. So in my practice, I am practicing since 15 years. And intercurrent remedy, role of intercurrent remedy is very, wonderful. I have treated number of cases after prescribing intercurrent remedy and followed by constitutional remedy. Let's see. So I have taken two literature of review. One Dr. Ismail Sheikh. He had done wonderful work, case studies for treatment of warts with homeopathy. What he had said, in this case series, 5 case studies are presented. In each of these cases, homeopathic medicine were selected on the basis of individualization, and these medicine were successful in the treatment of warts, causing removal and dissolution of the warts and relief of associated symptoms of the patient. Both Thuja and Causticum have been reported in literature as useful medicine for the treatment of warts. In most of the cases, 50 millisiemel potency were used. It has been observed that in case treated with 50 millisiemel potencies, the response to treatment was faster. So this is the conclusion of the research work which was done by the Dr. Ismail Sheikh. Second Dr. Mosmi Das and Dr. Ananya, also they have done wonderful work for case series of warts and its individualized homeopathic treatment. This case series suggests usefulness of the homeopathic treatment as a complementary and alternative therapy. This case series saw a positive result in homeopathy, where in conventional methods it needs to apply various external ointment and many other things. So these both are the research original study which I have taken as a literature review. So let's see my aim and objective. My aim and objective was to find out the efficacy of homeopathic medicine in treating Verruca vulgaris with its individualized homeopathic treatment. Research methods. Type of study was observational retrospective study. Source of data, cases from my private clinic, Home Homeopathic Clinic, Surat. Materials, case record performa of the clinic. Sample size I have taken 100. Duration of study 3 years. Selection criteria. Inclusion criteria, all cases irrespective of age and sex. Exclusion criteria, pregnant woman, immunocompromised person were excluding from the study. Response analyzed, significant improvement. Feeling of the mental and physical well-being with disappearance of the all sign and symptom. That is significant improvement. Moderate improvement. Feeling of mental and physical well-being with relief in suffering. That is a moderate improvement. Status view. There is no change in the patient's any complaint after taking a long type of treatment. Left the treatment. Patient didn't return for the further treatment. So we will analyze all the cases in these 4 categories. So let's see first case. So now please, I request to all doctor, please communicate with me. I present case. At the end of case, I will ask medicine. So please be active. A 30 years old male having complaint of multiple warts over the forehead and scalp since 2 years. No itching, pain and bleeding. On examination, blackish brownish in color, round and hard, moderate inside. This is a characteristic of the warts. Significant history. Family history and past history of predominant psychotic illness like diabetes, hypertension, stone, and hypothyroidism. These are cold drinks 3 marks and salt 2 marks. Aversion sweet 2 marks. Thermal chilly. By nature, patient is elder brother in family, very responsible, honest, sympathetic, and helpful person since young age. When patient was 5 years old, his mother was expired. Also, his sister had committed suicide at the age of 22 years. He felt intense sorrow but could not express. Basically, patient is family oriented and having too much anxiety, anticipation about family members, and futures. So please note down sign and symptoms. I will ask at the end of cases. Okay, so anyone tell me what are the characteristic symptoms in this case? Anyone? Please tell me, anyone? Please text the message. Okay, anyone can say which are the remedy? Which are the remedy useful in these cases? Please text the message. What is your remedy? Okay, Kostikam, Jyoti Rao madam, Principal CN Kothari, Kostikam, very good madam. Anyone? Anyone can say which are the remedy useful in this case? And which are the remedy in your mind? One, Kostikam. Second, okay, so let's see. I don't want to waste time. Let's see. Totality. So totality of symptoms: sympathetic, sensitive, can't support injustice, grief, sorrow, responsible, anxiety about futures of family, of others, desire cold drinks, 3 mark, salt 2 mark, aversion sweet 2 mark, and chili patient. So these are the reported totality. You can see group of remedy: first causticum, second phosphorus, carcinosin, sulfur, argentum. So I have prescribed medicine first thuja on the basis of psychotic predominant miasm and family history, then followed by causticum 33 doses and SL for 1 week. And after 1 month, causticum 200, and after that, causticum 1 m. So I have prescribed medicine in the ascending potency 30, 200, and 1 m. And within 7 months, patient got wonderful result. You can see in photograph. See all the words removed. So see, let's see second case. A 32 years old male having plain warts over beard area since 3 years. Ailments from after shaving outside. On examination, multiple small blackish and plain warts. Associate complaint: headache, which is aggravated after reading and noise and relieved by pressure on eyes. Significant physical general: thirst for cold drinks, desire for milk 2 mark, sour 2 mark, aversion bread 2 mark, salty food 2 mark, thermal hot. By nature, patient was very calm and cool and wants to remain silent and like peaceful environment. Wants to be alone. Can't share anything with anyone. Patient didn't like to hurt to anyone. Even if someone hurt to patient, still patient can't say anything. And he hurt himself by overthinking. Before 10 years, patient failed in GPS exam. He felt very bad. He was shocked. Didn't like to talk with anyone. Remain alone and weeping. When alone, he thinks why this is happen with me. Also, patient has anxiety about family, health, and fear of snake robbers and dreams of robbers. So anyone can say which remedy is coming in your mind. Yes, anyone, please text the message. Which remedy in your mind? Main theme of the patient. Okay, Aditi Rathod, student of the CN Kothari. Netramur, Pragati Gupta, Netramur. Very good. Anyone? Anything else? Raman, Calcarea carp. Okay. Anything else? Calcarea carp, Netramur, Palika, Netramur. Okay. So see, this is a main characteristic symptoms, that is a patient don't want to hurt and not to be hurt. पेशेंट क्या है, दूसरे को हर्ट भी करना नहीं चाहता है और कोई लोग उसको हर्ट करे वो भी उसको पसंद नहीं है. So this is a mainly characteristic features in Netramur: oversensitive and hypersensitivity. Netramur patient never like to hurt anyone, also never to hurt by anyone. So this is the main characteristic and entry point of natrum, and I prescribe natrum mur. Elements from disappointment of love: strongly responsible, sympathetic, reserved, aversion to company, anxiety about family, fear of snake and robbers, anxiety about health, family and health, aversion to company, and last weeping mood. So natramur was prescribed and see result. I prescribed natramur 33 doses, then natramur 201 dose weekly as per required, and after that natramur 1 m 1 dose for 1 month. So again, I have prescribed medicine in ascending potency 30, 200 to 1 m. But repetition and dose, that is mainly different thing. So see, you can see photograph. These all are the small warts or beard area, and after 9 months, all warts were removed. Case 3, a 32 years old female having complaint of viral warts over forehead region since 2 months. On examination, small, multiple, blackish and flat warts. Significant history: appetite, hunger can't tolerate, headache, aggravation by hunger, desire for sweet 3 mark, hot food 3 mark, spicy 2 mark, sour 2 mark. Aversion: beans, bread and peas. Thermal chilly, but patient feels better in open air. What is mental history? By nature, by profession, patient is interior engineer and doing job in private sector. Very ambitious lady. Ambition for name, fame, money, position, wants to be remain independent. Patient had anxiety during performance. She told me, I am very nervous for my first project work. I could not speak anything during Viva because of lacking in confidence. History by husband: she is very polite and humble with others, maintain relation perfectly, but very dominating at home. She got very angry when I was not agree with her opinion. Responsible at home and obstinate with family members. Dreams of fried food. Please, can you say which medicine you want to prescribe? Jyoti Rao madam, again lycopodium, very good madam. Pulsatilla, platina, Pragati Gupta, pulsatilla, okay. Anyone else? Okay. So, what are the differentiating point? Platina, that is a very dominating remedy. I'm going to differentiating these three remedy: lycopodium, platina, and pulsatilla. Platina very dominant and very dictatorial remedy, and very super ego and highly egoistic person. So this lady is not that type of person. Second, pulsatilla, exact opposite of the platina. Pulsatilla remedy is very mild, gentle, weeping disposition, and very down to earth. They can't speak. Okay. Third, lycopodium. So lycopodium patient is very dominating and dictatorial, but having a characteristic of the leadership. So and very ambitious lady. And lycopodium patient always want to be remain independent because they people didn't like any type of dependency on family member. So main history of the patient which are matching with the lycopodium. So I have prescribed medicine lycopodium. Let's see. One member tell me sepia. Sepia is very indifferenting remedy, occupational desire, and very workaholic remedy. They love very well with her partner, but very indifferent to other person. So this is a very extrovert lady and very ambitious lady. So I rule out the sepia. Totality: ambition for name, fame, money, position, lack of self-confidence, angry when contradiction. It is again angry when contradiction is the entry point of the lycopodium. Other remedy, aurum met. Angry when contradiction. Responsible. Desire for sweet 3 mark, hot food 3 mark, spicy 2 mark, sour 2 mark. Aversion: beans, bread and peas. Chilly patient, amelioration in open air, and gastric headache. These all are the characteristic features which are present in patient history. So I prescribe medicine lycopodium. You can see over the forehead, there are number of multiple blackish warts. I prescribe lycopodium 30, then lycopodium 200, again lycopodium 203 dose, and then lycopodium 1 m as per required. So you can see result. Okay, let's see. Case 4. A 30 years old female consult to me for her complaint of warts over eyelids, foreheads, and face since 3 months. Ailments from after lesser treatment for acne. On examination, small watery colored eruption, no pain, no itching, no bleeding, oily and unhealthy skin. Past history: ganglion operated, acne nodularis, and nasal polyps. For acne nodularis, patient had taken lesser treatment, and nasal polyp that is operated. Physical general significant: appetite, hunger, can't tolerate, headache, aggravation by fasting, desire for sweet 3 mark, aversion milk, perspiration profuse over the face, thermal hot, and patient also having history of recurrent cystitis, UTI. So mental history: a female patient belongs to very genuine, honest and religious family, mainly follower of the Dada Bhagwan. Patient is very anxious about her look and sensitive to rudeness, what other people say about her. She never express her anger in front of anyone. She always reproaches on herself for any fault in family. So these are the very characteristic symptoms. Patient having reproaches means any fault, patient reproaches on herself. So this is the entry point of my case. And sensitive to rudeness, patient can't tolerate any type of rudeness. By nature, patient is very gentle, honest and very sweet in talking. No any demands and expectation. She is very sensitive to accident and blood. Can't see, causes giddiness. Sensitive to quarrel, and she has fear of height and reprimands. So anyone can say which remedy you are thinking about, which remedy? Anyone can say? Lachesis. Okay, good. Lachesis. Anyone? You have to think about core of the patient, nucleus of the patient. Patient is very sensitive, reproaches herself. Dr. Jyotirao Madam, Steffi, very good. Also humble, humbleness and honest person. You have to pick the remedy from Materia Medica, which is having humble and honest person. Anyone? Lachesis and Steffi. So let's see totality. Patient is very honest. So I have to prescribe medicine, honest remedy, sensitive to rudeness, sensitive to others' opinion. Patient is very sensitive. Suppress anger, reproaches herself, sensitive to accident, blood, causes giddiness, sensitive to quarrel, fear of height and reprimands, desire for sweet 3 mark, aversion milk and gastric headache, and hot patient. These are the totality. So you can see Steffi number 1, Calcarea, natrum, nux, arsenic, carcinosin. These all are the group of remedy. I prescribe medicine first Thuja 200 single dose due to psychotic traits. Patient have a number of psychotic disease in past. So I have prescribed and I started my case with the Thuja 200. Then I prescribed Steffi 33 dose followed by SL 50 days. Then Steffi 200 1 dose in 15 days. And last Steffi 200 1 dose weekly. The patient recovered within 6 months. So I didn't require to prescribe any medicine in high potency. See, you can see photograph, all small warts. This is a mix-up picture of the acne and warts. You can see silver color and small eruption like skin lesion, that is a warts, and small blackish, that is a acne. So patient have taken treatment for acne nodularis and patient got infection of the warts. Last case, a 42 years old male had complaint of warts over beard area since 4 to 5 months. On examination, soft, large, 2 to 3 warts, bleeding easily when touched. Significant physical general, desire sweet 3 marks, perspiration profuse, thermal chilly. By nature, patient was very anxious about his illness and his family, especially for his children's future. Even if the child goes out and there is a little late return to home, then he is constantly thinking what will happen. Also, he had feeling of injustice due to his father's strong attachment with his elder brother since 1 year. So he said that I felt feeling of injustice. મારી સાથે જ અન્યાય થતો હોય તેવું લાગે છે. હું બીજા સાથે પણ અન્યાય થતો હોય તો પણ સહન ના કરી શકું. મને ગુસ્સો આવી જાય. આવું પેશન્ટે કીધેલું છે. ઓલ્સો પેશન્ટ ઇઝ વેરી મચ સિમ્પેથેટિક, સ્પેશિયલી ફોર પુઅર પર્સન. Sometimes weeping from sympathy with others. So my entry point was sympathetic person and injustice. These both are the polarity of the medicine. I want to prescribe medicine which have a sympathetic tendency and injustice can't support. So I think medicine is very clear. Jyotirao madam, Aditi Rathod, Pragati Gupta, Kostikam, very good. So very simple and sober cases I have presented. Let's see medicine. Okay, totality of symptoms: anxiety about family, his illness and children, fear of something will happen, injustice can't support, sympathetic, weeping from sympathy with others, desire for sweet, perspiration profuse, and chilly patient. So I prescribe medicine Causticum. See, these are the warts for the beard area. I started with Causticum 30, then Causticum 200. As per required, I repeated medicine during course of treatment. So this is the before and after. All warts were clear. Okay, so these are the cases, and I can say this is a mainly role of homeopathy. We are doing nothing. This is the main efficacy of homeopathy. Because of lacking of time, I am going to present few glimpses. This is the first glimpses before warts, large warts over the beard area. I have prescribed medicine Calcarea silicata, and within 7 months, you can see result. Big in large were cleared. Second case, molluscum contagiosum, very small warts over the face. And this case cleared within 5 months. I prescribed medicine pulsatilla. You can see before and after. Third warts, very small and blackish, multiple warts over the beard area before, and I prescribed medicine Causticum. Fourth case, multiple and small vesicles like eruption over the beard area and lips. I prescribed medicine Calcarea sulf. You can see result. This is a case of genital warts, multiple genital warts, mainly patients had suffered after taking visit to Thailand. So this is a very infective warts, and we can say STD, sexual transmitted disease. You can see I prescribed medicine nitric acid. Before 3 months, after 5 months, you can see warts will become large. After 7 months, more large, and after 8 months, start to reduce the size. And after 9 months, all warts clear from the penis and glans penis. Sixth case, little baby, very cute and attractive baby, very extrovert baby, and multiple eruption over the face, looking very bad. And also baby were coming from very good family. I prescribed medicine phosphorus. You can see before, after 5 months, most of warts were cleared, and after 11 months, all warts were cleared. These are very simple warts in both cases of causticum, warts over beard area and warts over mustache area. You can see before and after. Again, this is a genital case of genital warts. You can see before only 3 to 4 small warts. After prescribed homeopathic remedy, all warts are increased in size. After 4 months, there are multiple blackish warts. You can see after 5 months, warts are going to decrease. After 6 months, you can see maximum warts were cleared. After 7 months, only 5 to 6 warts were remaining. After 8 months, only 3 to 4 warts was there. And after 10 months, you can see all warts were cleared. I prescribed medicine natrum sulph. Natrum sulph. This is again good case of the genital warts. This is a periungual warts in both and 6 years old baby. I prescribed medicine pulsatilla and she got result within 8 months. You can see before and after. And this is a 9 case. Few blackish warts over the beard area. I prescribed medicine causticum and after 5 months you can see result before and after. Last 2 cases. Before multiple small blackish warts over the forehead, I prescribed medicine lycopodium and you can see result after prescribing lycopodium. Patient got result within 5.5 months. And last case, multiple small warts over the beard area after visiting at the barber and shaving outside. So before and after 3 months, you can see case, and after 5 months, last photo. So before, after 3 months and 5 months, I prescribed medicine natron sulph. These were the now result analysis. An observational retrospective study was undertaken to study the efficacy of homeopathy in treating the cases of verruca vulgaris. I have taken 100 cases for study and evaluated after analyze each case in detail. Statistical analysis of the descriptive data was done by numbers and percentage according to different categories. See, you can see maximum patients were coming from middle age group, 21 to 40 years of age. 36 patients from 31 to 40 years of age and 25 patients from 21 to 30 years of age. So middle age group are suffering from warts, more prone to warts. You can see male are more prone to warts than female. 65% cases from male group and 35 cases from female group. As per types of warts, I have seen in my clinical practice, common warts is commonly seen in my practice, then molluscum, then plantar warts, and last filiform warts. So common warts is commonly seen in our practice. I have used intercurrent remedy during course of the patient. So thuja in 62 number of patient, tuberculinum in 8 patient, medorinum in 4 patient, sulfur in 2 patient, and I didn't prescribe any intercurrent remedy in 24 cases. I prescribe intercurrent remedy only on the basis of the strong myism, family history, and patient past history. Otherwise, there are no require of any intercurrent remedy. I have prescribed medicine, number of remedy in 100 cases, causticum at the top in 21 number of patient, natrum sulph in 9 patient, nitric acid 9 patient, lycopodium in 8 patient, entim crude in 7 patient, staphy in 7 patient, dulcamara in 6 patient, natrum urine in 6 patient, baryta carb in 5 patient, graphitis in 5 patient, calcarea carb in 4 patient, calcarea phos in 3 patient, calcarea sulph in 3 patient, phosphorus again in 3 patient, and pulsatilla and sepia in 2 patient. So most commonly medicine which are occurred during my study, that is a causticum, natrum sulph, nitric acid, lycopodium, and staphy. result analysis, I have seen significant improvement in 56 cases out of 100 cases and moderate improvement in 14 cases out of 100 cases. Left the treatment 18 cases and status quo 12 cases. 12 cases got not any result after taking 6 months, 8 months, 1 year of treatment. So this is our failure rate. Discussion. During entire study, 100 cases were taken to understand the efficacy of homeopathic remedies in cases of warts. In 100 cases, 65 patients were male and 35 were female. On the basis of nature of disease, all cases were chronic in nature. As per age incidence, 11 cases from 1 to 10 years of age, 8 cases from 11 to 20 years of age, 25 cases from 21 to 30 years of age, 36 maximum cases 36 from 31 to 40 years of age, 7 cases from 41 to 50 years of age, and 8 cases from 51 to 60 years, and last 5 cases from 61 to 70 years. In all chronic cases, I have used constitutional medicine and intercurrent remedy. In those cases where it required, the result of treatment of 100 cases, in 56 cases, significant improvement. In 14 cases, moderate improvement. In 18 cases, patient left the treatment, and in 12 cases, status quo. Conclusion. During the entire study, 100 cases were taken to understand the efficacy of homeopathic remedy in cases of warts to draw conclusion. All cases were studied in detail. Cauterization is one of the way to remove the warts which maximum number of people use as a treatment for the fast result. But even after cauterization, warts do reappear in exaggerated form because warts are only external manifestation of internally disturbed vital force. Therefore, even after its removal, vital force expresses its derangement in more exaggerated form. In the cases of warts with homeopathic management, the cause is treated by constitutional remedy and use of intercurrent remedy where it required. In this way, cause is treated with a simillimum without any suppression in more gentle and harmless way. Viral warts were most common in the young age group between 21 to 40 years of age. Males outnumber than females. The face was commonest site which was involved. Common warts were the commonest type of warts. Best result is produced by use of constitutional medicine along with the intercurrent remedy. These are the conclusion of my research study. I have taken 100 cases and these are the point. So my suggestion to today's young generation, we have to study can only mother tincture helpful in treating warts or not. I have heard from number of doctor, mother tincture is very useful, but I never prescribe any mother tincture. So I want to know in future, can only mother tincture, not mother tincture with constitutional medicine, can only mother tincture helpful in treating warts or not? This type of research is necessary in future. Limitation of the study. This study conducted by taking 100 cases, pregnant women and immunocompromised patients were excluded from the study. These all are the reference which I have taken during my study. These are all are the book reference. I have referred Dr. Hyman's book, Mahajan's book. Also, I have taken two literature of review, Dr. Mosmi Das, Ananya and Dr. Sheikh. These all are the web references. Thank you. So anyone have any confusion, doubt, you can ask me.
Thank you, sir. Thank you, sir, for your wonderful session and for your valuable time. The session was really very useful, and each and every words of yours were very clear cut, and it was easy to understand. Thank you, sir. Doctors, now if you are having any doubts or if you are having anything to share, you can turn on your mics and you can share your words.
Anyone have any confusion, any doubts, you can ask me. We have a 10 to 15 minutes. Please raise your hand. Thank you. Thank you. Dr. Sweta, you can ask. Anyone have any doubt?
Doctors, if you are having any doubts, you can please raise your hands. Yeah.
I think Dr. Sweta, Dr. Indranil sir want to ask something. Please unmute. Thank you, Rajnish sir.
Yeah. Thank you,
Yes,
sir.
sir.
Can you
Okay, sir.
hear me?
Yes,
Yeah,
sir.
yeah.
Yes, you can
Yeah.
ask.
Firstly, I will say that the presentation was very nice.
Thank
It
you,
was
sir.
actually like a protocol of a thesis for PG and a good statistical and evaluation study. Yeah.
Okay.
Some two practical questions which come to the mind, which I also face. Your cases, you have shown that the results were there after 3 months, 5 months. Some cases were 7 months. They may take time. How do you convince your patients to wait for so long time? Because they expect a homeopath to give immediate result because they come to us as a second opinion doctor. So can you guide for that? How do you make them wait for
Yes,
3,
sir.
5 and 7 months?
फर्स्ट ऑफ ऑल सर, मेरी प्रैक्टिस में मैं सबसे पहले क्या करता हूँ, कोई भी पेशेंट आए तो उसको एक बात, कोई भी केसेस हो, कोई भी डिसीज हो, कॉमन कोल्ड कोराइजा हो या थायराइड या डायबिटीज हाइपरटेंशन हो, पेशेंट को पहले उसको माइंड में डाल ही देता हूँ कि आपको वेट करना है, पेशेंस रखना है, हम
Yeah,
कोई
yeah.
भगवान नहीं है। ठीक है, आप पेशेंस रखेंगे, सबसे पहली मेडिसिन जो है वो धीरज है। पेशेंस रखेंगे तो ही आप ठीक होंगे, वरना आप डॉक्टर चेंज करते जाएंगे तो आप कभी ठीक होने वाले नहीं। तो मैं पहले ही ब्रेन वॉश कर देता हूँ उसको, उसको धीरज रखनी है, मेडिसिन जब भी काम करे। तो 3 महीना तो वैसे ही पेशेंट मेरे पास आते हैं कि सर ने बोला है धीरज रखना है।
हाँ,
ये
अच्छा,
कोई भी कंडीशन के पेशेंट है, 3 महीना वेट करते हैं। ठीक है।
बराबर।
और मेरा वो कॉन्फिडेंस है कि अगर हमारी मेडिसिन, हमारा केस टेकिंग अच्छा है, हमारी मेडिसिन सही है, तो हमको 3 महीने में 10 to 25% रिजल्ट दिखेगा दिखेगा दिखेगा।
हम्म,
क्योंकि अगर सब कुछ ठीक चल रहा है तो मेडिसिन वर्क करनी ही चाहिए, और कुछ
चाहिए।
कुछ चेंजेस होना ही चाहिए, आइदर नेगेटिव और पॉजिटिव, वट एवर।
हम्म,
मगर आप 3 महीना मेडिसिन देते हैं और कुछ भी चेंजेस नहीं, कुछ भी बॉडी में हलचल नहीं है, कुछ भी वाइटल फोर्स रिएक्ट नहीं कर रहा है, मीन्स कि आपकी टोटली मेडिसिन रॉन्ग है। तो
हम्म,
अगर आप क्लासिकल प्रैक्टिस करते हैं, आपको पेशेंट इतनी मेंटल हिस्ट्री देते हैं, आपको 1.5 आवर केसेस देते हैं, तो टोटल रॉन्ग मेडिसिन तो हम प्रिस्क्राइब कर ही नहीं सकते, क्योंकि हम
नहीं सकते, बराबर है, बराबर है।
इंडिविजुअलाइज रेमेडी देते हैं और टोटलिटी के ऊपर रेमेडी देते हैं, तो ऐसा तो
करेक्ट।
पॉसिबल ही नहीं है। सो आई एम टेलिंग यू ऑनेस्टली, आई गॉट 80% रिजल्ट इन माई क्लिनिक। Out
अरे
of
वाह, वेरी
100 patient, I got 80% result, 20%, in 20% I definitely, I accept
गुड।
failed.
Yeah, that's a good point of view. Yeah, and second point out was about the entry point in cases. It differs from case to case. I know it, but like, what should be for these newcomers? Entry point should be from the present state, or it should be a constitutional symptoms. What will you guide about that?
Sir,
Entry point in a case, any
I
presenting
like
case.
I like to say I am a professor in community medicine in a
Yeah,
CNT Viara Medical College, and Dr. Jyoti Rao Madam, my principal, I am very happy. She
very
attended
nice. Yeah,
throughout the session. I always told to my student, first in UG, you have to refer materia medica, basic materia medica like Dubé, Boric, Allen
yeah,
scheme, Atta.
yeah, yeah.
Don't go in that detail. Only materia medica. First, try to increase confidence and interest. After fourth year in internship, you have to start to read Kent Materia Medica, lecture of Kent Materia Medica, because Kent has described wonderful all the medicine in a theoretical way and lecture way. So they mainly helpful in clear the image of the patient. And after that, I always suggest Solop Materia Medica Sankran sir, Genetic Materia Medica Vijikar sir, Philip Bailey Homeopathic Philosophy, Vermeulen Prisma. These all are the lecture type of materia medica. So we can prescribe medicine on the basis of personality, patient personality. If there are calcaria, then there are more insecurity, wants of supports, wants of magnetize, number of fear. If there are kali, then duty conscious, very perfect, time to time person, very duty bounded and rules and regulated person. So these all are the personality of the medicine. So I prescribe
Medicine.
on the basis of personality.
Okay, okay.
There
So
will be less chance of failure.
very nice. Because entry point गलत हो गया तो suppose
Yes,
results नहीं
yes.
आते. So that's a good
अगर
thing.
मेरा
Good thing.
एंट्री पॉइंट सही है सर, और 3
बराबर है.
यूरिक मैंने आपको बोला ना, स्टेफी में मैंने रिप्रोचेज लिया है,
Yeah.
सेंसिटिव लिया है, ठीक है, अगर
Yeah,
उसकी
yeah.
थर्स्ट मैच नहीं हो रही है तो कोई दिक्कत नहीं है। अगर
बराबर है,
उसकी
बराबर।
एपिटाइट मैच नहीं हो रही, कोई दिक्कत नहीं है। मेन उसका 3-4 जो एंट्री पॉइंट है, डॉक्टर केंट ने भी वही बोला है कि अगर आपका मेन कोर मैच होता है तो आप भूल जाओ कि 2-3 फिजिकल चैप्टर नहीं होता तो जाने दीजिए।
वेरी ट्रू, वेरी ट्रू,
इसके
वेरी
बेस
ट्रू।
पे मैं प्रैक्टिस कर रहा हूँ सर।
थैंक्स फॉर योर एक्सप्लेनेशन, वेरी नाइस एक्सप्लेनेशन, थैंक यू सर।
Sir, there is a question in chat box.
ओके
Dr. Panchal is asking, what are the role of external applications preferred homeopathically in cases of warts and other cases?
Okay, so I already told you, doctor, this is a mainly future confusion, and I want to also know that can only mother tincture useful in case of the warts or not. I never prescribe external application in any cases, not in eczema, not in warts, not in ringworm. I never prescribe external application. So I can't say anything about external application because I didn't any experience.
So one more question is there. Dr. Pragati Gupta is asking, how do you select the potencies of the remedies?
Mainly, I have selected potency on the basis of susceptibility and family history, strong, dominant, and fundamental miasm. In maximum chronic cases, I have started case with the medium potency. Then I am going in ascending potency, 30, 200, 1M, 10M is per required. But in most of the cases, I start the case with the medium potency. In acute cases, I have started case with the low potency with frequent repetition. In chronic cases, medium and high potency with less repetition. Okay, anyone?
Yes, Dr. Pankaj, sir.
Yes, sir, बोलिए कैसे हैं?
It's really very nice presentation, and it was just like a teacher-student interaction. And the interactive session was also very good because that uh, made the participants to participate in this session actively, and some of them give wonderful answers also your question, and I have shown that even a pulsarilla can cure a wart. Usually, people believe that we have certain remedies which are specifically for these warts, but instead of that, you just stick on with the constitutional medicine. I must say the right remedy and then right medicine that work.
Thank you, sir.
Yes. This is what we get from the presentation. That's what that's my observation. And all the cases, you just waited. Because of your confidence, you're able to wait. Otherwise, people may believe, oh, it is some 2 to 3 months. Still, it is remaining as such as what
Yes,
it
sir.
before. So, all of a sudden, the things may happen. I still remember a case of of a boy who was studying at the seventh standard some years back, and he was treated by many homeopaths and some specialists of that area. And they told me that a doctor, he's suffering from this much of not only warts in the face or but everywhere he has warts. So we just, what I did was I just stick on with the stuja itself. And I got the result after some uh, nearly 1 year. I just wait with this because that was the condition of the case. And in the beginning, I gave us a dose of sulfur also, but later I just stick on to Tuja itself, and it works. What happened was all of a sudden it started falling, and then within 1 week everything was over. So that I have seen such a wonderful result in that some of in my early days of practice. So, what is your uh, opinion on calcium deficiency and whether you allow the patient to give any calcium supplement or ask the patient to take some milk or egg like that? Because I have seen that if you allow the patient to take some egg, that will give better result in short time.
Sir, honestly, I am saying I prescribe mainly biochemic for the any deficiency. Calcium, I my choice of remedy Calcarea phos and Calcarea carb.
Exactly.
And for the B12, I prescribe multivitamin or any single B12 contain medicine.
Yes, Calcarea phos is a very good remedy.
6x, 3x, 6x.
Exactly. This is what I used to give also. And
In case of osteoarthritis, sir, I prescribe biochemic with nosodes osteoarthritis 30.
okay.
First, I prescribe osteoarthritis 30, 3 dose. Then I shift the patient on the biochemic medicine.
Okay.
I never prescribe any two remedy at a time.
Okay, with the constitutional medicine or without constitutional medicine, you may give the same.
In
Whether,
which case, sir?
for example, if you find that the patient is of Maxol or Rustox,
Sure.
you give first Rustox or Maxol 1 and then you give osteoarthritis or then Calcarea phos like that.
Yes, in some cases, sir, I have seen that I have to prescribe acute remedy like Rustox, Bryonia, Ruta in such type of chronic disease, especially RA and second and third degree of osteoarthritis. If patient got relief with the acute remedy, then I prescribe constitutional remedy or biochemic remedy. But first, I prescribe acute remedy. After got 30 to 40% relief, then I prescribe constitutional remedy.
Okay, what about the osteoarthritis 30? Whether you continue the same for some more time or just give 3 doses only?
No, sir. There are mainly irreversible disease. Osteoarthritis cannot cure.
Yes.
This is only I prescribe medicine on the basis of palliation or some got relief. So we can wait for surgery for long time.
Okay.
If patient didn't want to operate or take care, then definitely we can prescribe medicine, homeopathic medicine for the long time to reduce disease, and that is a tertiary type of prevention. We can say tertiary type of prevention. We can't cure, but that is a palliative type, and we can prevent the complication.
Exactly.
We can at least we can give a better life with homeopathic medicine.
Exactly. I think Dr. Ambrose sir is want to speak something. Yes.
Thank you, Dr. Dhanesh ji and Dr. R. Shweta. Congratulations, Dr. Pankaj sir.
Thank you, sir. Thank you.
Very nice presentation. भेरुका कि करीब मंथली प्रैक्टिस में दो एक तो आ ही जाता है सभी होम्योपैथिक डॉक्टर को भेरुका का पेशेंट, लेकिन मेरा जो अपना मानना है
सर स्पीक इन
फर्स्ट भेरुका इज द फर्स्ट सल्फर 31 डोज,
सल्फर 31 डोज,
1 डोज सल्फर 31 डोज एंड अदर कॉन्स्टिट्यूशनल रेमेडी, लेकिन पूजा साइकोटिक रेमेडी पूजा कास्टिकम नेट्राम्यूर एनी एंटीम्क्रूड, लेकिन फर्स्ट डोज सल्फर 30 जो है। माई प्रैक्टिस 35 इयर्स तो करीब करीब देखने में आया है कि सल्फर देते हैं तो बहुत अच्छा से ठीक होता है, तो बहुत अच्छा है सर, बहुत बहुत धन्यवाद।
Can you say sir on the what basis you can prescribe sulfur?
बैकग्राउंड ऑफ स्टोरी एक विदाउट सोरा कोई एनी डिजीज, सोरा इज अ बैकग्राउंड, कोई भी बीमारी में रहता ही है, बिना सोरा का तो कोई बीमारी नहीं है। सोरा तो सब लोग, ऑल मैन सफरिंग फ्रॉम सोरिक इन नेचर, विदाउट सोरा नो डिजीज। थिंकिंग ही सोरा, सोच ही सोरा, आप क्या नेगेटिव हो या पॉजिटिव, नेगेटिव है बीमारी कन्वर्ट एंड पॉजिटिव तो इसलिए सोरा इज बैकग्राउंड। मेरा
Okay.
तो है कि किंग ऑफ एंटीसोरिक रेमेडी सल्फर एंड सोरिनम, क्वीन ऑफ एंटीसोरिक रेमेडी सोरिनम, एंड किंग ऑफ एंटीसाइकोटिक रेमेडी थूजा, एंड क्वीन ऑफ एंटीसाइकोटिक रेमेडी मेडोरिनम, किंग ऑफ एंटीसाइकोटिक रेमेडी मर्कसोल, सिप्लिटिक रेमेडी मर्कसोल, and queen of anti-syphilitic remedy syphilinum. तो इस आधार पर my practice, mathematic background of practice, family history and past history, and there are two types of symptom: subjective symptom and objective symptom. Objective symptom, यदि किसी को ट्यूमर है या एज बिफोर यानी 15 ईयर 20 ईयर हेयर ग्रे, तो बैकग्राउंड ऑफ साइकोटिक, वेरी वेरी
Good, sir,
टाइम।
good.
Dr. Pankaj, there is a question in chat box.
Yes.
What is your experience with the sixth potency?
Okay.
Dr. Jyotiraj is asking.
Okay. Sorry, madam. Honestly speaking, I didn't prescribe 6 potency in any cases. I didn't prescribe 6 potency in any cases, especially in wards. I have started with the 30 potency. Vitamin B12, we can prescribe medicine, plain medicine, neurobion forte. If you want to give with other vitamins, then neurokine. These all are the supplement. So these all are not allopathic medicine. We can prescribe medicine with the homeopathic medicine. Dr. Haniman write in a organ of medicine, auxiliary methods, blood transfusion, oxygen, vitamins. These all are the supplements. Okay, anyone?
Sir, can I add a little? Can I add a little thing? If there is a few 1 or 2 minutes, can I add a little thing? Yeah, actually, sir, osteoarthritis nosode you mentioned very nice.
Okay, sir.
In clinical observation, one more addition I would like to say. Yes, there is one more nosode called as polyarthritis. And actually, arthritis, yeah, and actually osteoarthritis is common in both the knees. So
Oh.
sometimes I have seen it hardly works, sometimes doesn't work. But polyarthritis had worked very well for multiple joint involvement, especially in RA or osteoarthritis. And rightly you mentioned, I work in CRF more. These patients are anemic, and morphologically, their RBCs are normocytic, normochromic. So there
Okay.
is no deficiency correction. Like if you can give vitamin B12, folic acid, it doesn't work. If you give hematinics, it doesn't work, and their hemoglobin levels are always down.
Okay.
So, like many patients ask me, sir, ferrum phos, anemia biochemic preparation, is it going to help me? But honestly, it doesn't help. So, like you mentioned, in auxiliary treatment, it is right. We should go with the supplements only. We should not think about homeopathic supplements.
Okay.
So that's a good thing, because they are deficient in erythropoietin, so that's why they have anemia.
Okay, sir.
That I've seen.
Definitely,
But
I will
biochemic
keep working.
doesn't work as it promises. In our mind, we think that calcarea will correct the calcium deficiency, but it sometimes it works, sometimes it doesn't work. So
Yes.
supplements are really helpful to us. Yeah,
Either
that is
diet or supplements.
very true, sir. Yeah, that was only our two additions in that.
Thank
Huh?
you. Thank you,
Thank you,
sir.
sir. Thank you.
And now we can invite Dr. Sudhi
Yeah.
Sariga for auto thanks. Yes, there is some problem. Oh, okay. I shall. Anyway, we are very happy with such a beautiful presentation from Dr. Pankaj in this evening. And we have a lot of very good case presentation as well as a lot of discussion from participants. And I am congratulating all of you participating in the session also. And special thanks and congratulations to the guest, Dr. Pankaj, and the moderator, Dr. Shweta. And with that, we come to over to Dr. Shweta. Thank you, sir.
Thank you. Thank
Thank you all
Thank you,
for
all of you.
thank you all for such a beautiful session. It's over to